Welcome. Today we're with Dr. Randy Staples of Mini Dental Implant Centers of America. Welcome, Dr. Staples.
Hi.
Tell us about Mini Dental Implants and how you got involved with them.
In November of 2008, I was in the middle of a dental procedure, actually, close to noon, and I had a telephone call from a really good friend of mine, Dr. Barry Glenn. And in the conversation, he asked to borrow a mini dental implant and a specific size. And I said, Barry, what are you talking about? And he told me a little bit about what he was talking about, and I said, where did you get this information? And he said, well, and he told me the person's name, and I said, listen, I'm going to come over to your office right now. So I finished up the patient and went to his office. And he showed me what he was talking about, and I got a telephone number and came back to my office and was going to call and leave a message. And actually, Dr. Todd Shatkin, who is now a real good friend of mine, picked up the phone, and we had about a 20-30 minute conversation about small diameter or mini dental implants and the implications of what could be done. And I was just blown away. So I said, well, I've got to get my hands on some of these. And he said, well, I usually like to train our doctors before we, and I went through my portfolio with him and what I'd done in the past with traditional implants. And he said, well, I'll tell you what, I'm going to send you some demonstration tapes. And I guess in January I called him back and said, well, I've placed a few and I would really love to come to your office, spend some time with you. And so that's what I did. And I went to Buffalo in June and I did a residency with him in his office, and came back to Jackson and made that an integral part of my practice.
Can you tell me about the difference between traditional and mini dental implants?
The procedure itself is quite different. I did traditional implants for many years, and with the traditional implant, it involves surgeries, at least 2 surgeries. The initial surgery would be a patient goes in and they split the gums open and they drill a hole in the bone, the depth of the implant. Then that implant is placed, is called a root form. It's determined the width and the depth of the ridge itself, of the bony ridge, and they choose the implant. That implant's placed and it's sewn up, and 4 to 6 months later, you go back into another surgery and uncover that implant and evaluate to see if it's integrated to the bone. If it has, then you go ahead and attach that little piece that sticks up out of the gum that we know, we've all seen, that we place our crowns or either use to stabilize the denture or partial. And so it's a 2-step procedure, at least a 2-step procedure. If there's not enough bone, then you have to have a bone graft. We've all heard of people that had required sinus lifts or some type of a bone graft material to build their jaw up to receive an implant. So it's an invasive procedure, and it requires anywhere from 6 months to 12 months probably sometimes to get your restoration done on top of that traditional implant. With a mini implant, it's much different. Some people call it a non-invasive procedure. I drill a small pilot hole. I give a little anesthetic right at the site where the implant's going to go, and then I drill a small pilot hole, and with my surgical handpiece, I literally thread that implant down into the bone, and as it threads in, it tightens up. Enough so that after we place the implant, if we're doing a single crown, we can actually place a crown on that implant at the same appointment, same day. So, and in contrast to the traditional, what could require 6 to 12 months to complete the procedure, with a mini often can be done in less than 4 or 5 hours.
That's really exciting that someone could actually, in essence, walk out of your office in the same day with a brand new smile.
Yeah, that is.
So tell me a little bit about who are candidates for the procedure.
Okay. We have people call our office after they see our advertising or after someone has talked to them about mini implants. We have people call our office, and Donna usually answers the phone up front, and she's really good about answering their initial questions. Sometimes that's all it requires, is they're just wanting to know some basics about mini implants, and she gets into with basically about some of the cost. But after talking with them for a few minutes, if she deems it necessary or good that they might come to see me, then she sets up an appointment with them. And in our office, that's a free appointment, that's a free consult. And the patient comes in, and I walk in and introduce myself and ask what I can do for them. And then they give me tell me what they'd like to have done. And in just a few minutes, I do an examination. I go over their medical history with them. If I deem it necessary, I'll take an x-ray, and within just a few minutes I can actually tell if they're going to be a candidate for a mini implant.
So tell me a little bit about how mini dental implants can help people with dentures.
That's a good question. Originally, that was the purpose for mini dental implants, to stabilize loose dentures. I mentioned a while ago in 08 and in 09 when I actually placed some, my first implants that I placed were actually for crowns. But like I said, the mini dental implant really started being utilized to stabilize lower dentures. It's a great restorative work. I mean, we have people that are walking around with that have had dentures for years, and they've lost that ridge. The ridge is resorbed away, and they're using that goop stuff, I call it goop, to help hold their denture, and they have to glue it in the morning, and then midday if they drink a cup of coffee they have to re-glue it, and then at lunch, and then in the afternoon, and then get home at night. If they want their denture in their mouth, they have to glue it in again. If not, it goes in the jar or in the glass to clean. But with the mini dental implant, and if the denture kind of fits their mouth and they like the way it looks, and after they glue it in, they can eat with it. We can literally, in a relatively short time, within an hour or hour and a half, we can place 4 or 5 mini implants and then retrofit that denture that they have to those implants, and they can walk out of the office with a snap-in denture that they can go eat a meal with and don't have to worry about replacing using that goop.
So tell me, is the mini dental implant procedure relatively painless?
Yes, it is. I mentioned earlier with the traditional implants require surgeries and extensive surgery sometimes, and with that's associated some swelling and pain. With the mini implant procedure, as I briefly mentioned, we use a little local anesthetic just at the site where we're going to place the implant, just to numb the gums. And then we drill a small pilot hole, a millimeter in diameter, into the bone, through the gum into the bone, and then with my surgical handpiece, I literally screw the implant into place. It's very. If some people advertise it as a non-invasive procedure, I think since I'm drilling a small hole in the bone, I don't call it non-invasive. I call it less invasive. Because it's less invasive, there's less pain, post-operative pain. Many times, with just 1 or 2 implants, I just suggest they use an over-the-counter medication if they do have some discomfort after the numbing wears off. But if I might send home a prescription if I do 8 or 10 implants, but many times those people come back to me the next day on a follow-up post-op visit and say, you know, I never had to take a pain pill. So it's less invasive. It's less healing time involved, and you can get right down to putting the restorations on top of those implants, whether it be a denture, where you're stabilizing a denture, or 1 or 2 crowns, or even a bridge, or a partial.
All of this just sounds so wonderful. Tell me about how the process has changed people's lives.
I have an example. A lady came in to me probably 3 or 4 years ago now, but she actually came in and brought a sack full of dentures with her. She had had her teeth extracted when she was 18 or 19 and had a set of dentures made. And she said from day one she had extreme difficulty wearing those dentures. And every 3 or 4 years she'd have a new set made, and nothing worked. And she brought her latest set in with her that she just had made 4 months prior. And I asked her if she minded if I tried, and I placed the denture in her mouth, and immediately I could tell that she had a strong gag reflex with the upper and the lower. And an upper denture can do that. It covers your whole palate and extends way back down in the throat, and some people just can't handle that. Well, I adjusted that denture there on the spot, and it was better, but I could still tell that she was going to have problems. Well, I took my models and I showed her what we can do, and she said, can we do that? And I said, sure. So we actually, the next day, we set her up an appointment. She came in that morning, and we, in less than an hour and a half, we stabilized that lower denture. It fit her mouth as long as I held my hand in there. We placed the implants, and she couldn't believe it. And she said, is there any way that we can do the upper this afternoon? So we made some time for her, and we did that. And I wanted to see her the next day for a follow-up, but she told me that she and her mom actually went out to a restaurant that night. She had not done that in 10 or 15 years. She just did everything at home. She was pretty much a recluse. All of her family functions were done in her home, and she would just try to glue her dentures in and run to the doctor or run to the grocery store, run to church, and then get back home. And so she was just so tickled. She brought her mom in to see me, and she's actually referred me a lot of patients. So I'd say it changed her life.
That's a really powerful story. Now let's hear from some more of Dr. Staples' patients.
Yeah, it's, you know, I don't mind smiling for pictures again, you know. There for a while I had been hit right in the mouth with a baseball, and for years I had like a dead tooth right in the center of my mouth, and there wasn't really anything to do about it. So after the implant procedure and the tooth was replaced, you know, it's like your natural teeth. You know, it's like being 16 years old again with all of them intact. You know, I was always very cautious about what I ate and, you know, make sure I took care of the temporary fixes that we had to do, the bridges and, you know, caps and all that. And then when the implant process came along, you know, it's just like having your natural teeth back again. I really can't tell the difference in, you know, the ones that are mine and the ones that we've had implants done on. Dr. Staples really has the patient's interest in mind in this process and procedure, and he gives you the options and lays it out. But it's totally painless. I mean, it's probably the easiest dental procedure, and I really don't like going to the dentist, but it's probably the easiest dental procedure, you know, you can have done, because when you walk out, you're ready. You know, you're ready to go. There's no delays, no time in between. It's just, you know, you have your teeth back again. Yeah, and he gave me the options. He said, you don't have to do it this way, but you know, here are your options now. So it was, he definitely lays them out. He never tries to pressure you into getting something done, which I really like that. I was really excited about the implant process and the results afterwards. It was like, you know, I felt like a different person. They kept, you know, taking pictures and showing me my teeth in the mirror, and it was just like having a new set of teeth, honestly, and most of them are still mine. That's the good part. Yeah, the mini dental implants are much more affordable than the full implants. It takes several months to you know, go through the entire process. I've never had one of the mini implants fail at all, and you know, sometimes you have to go back for adjustment of the length or something like that, but I've never had one fail, and they wear like your natural teeth. So you know, as your other teeth wear some, then these wear along with them. So it's just like having your natural teeth again.
Mini dental implants. They'll be there forever. You just feel better, because if I had to have had a bridge or something like that, you would worry, okay, this is gonna break, or I really don't want to smile. You know, does it look right? It's just so natural. When you get them, you're just like, oh yeah, look, you know, it looks better than what it did before. As to where, you know, if you had to get a lot of, you know, like all kind of, you know, big dental work, this or that, this is maybe an hour procedure. I mean, an hour. You know, okay, I have got my smile back. My teeth look so much better now. It's a wonderful thing. I tell everybody about Dr. Staples. Just go see him. He will make you look good when you walk out. And then you walk out of there and you're just, you know, you're fine. Everything looks good. And you just grin a lot. That's what it did for me.
The nice thing about the mini implant procedure was it was, relatively speaking, smooth. I've had procedures that were multi-visits that were quite painful and uncomfortable, and so I'm accustomed to that. If anybody's had a process of going in and having a root canal done, you know, it's not a pleasant procedure by any means. But I can tell you with the mini implant, it really was what Dr. Staples says. It's a one day, you're in, you get the whole process done, and you walk out of there and you can have a steak dinner with corn on the cob that evening. I mean, it really is. And I was kind of amazed at that part of it, because I expected some serious level of discomfort. I mean, I just simply did. And I never had it. And I've had several procedures, several implants, and they've all been the same. It's been a very straightforward procedure. So the process with the mini implant is it's very much like a tooth that was there on your own accord. It was simply, you know, you don't realize that you don't have a regular tooth that you'd started with. It's a very fascinating procedure, but like I say, it's something that is relatively quick to do, relatively speaking, and it is certainly way down the scale in terms of the complication and the process and everything else. From a qualitative point of view, quality of life, I can tell you it's like I had my original teeth. In fact, at first I had my tongue was running into a couple of the teeth because I hadn't had them there for a while. But the truth of the matter is, it's very much like you have your own teeth and you don't even think about it. It's that simple. I also have had a friend who had a traditional implant done on one tooth, and I can tell you he's had a year's worth of experiences with another dentist in the area. And he had a years-long process and had all kinds of issues that arose with that. Here I had 4, 5, 6 teeth done in one day, and I didn't have any of that sort of experience at all.
Welcome back. We've just heard from some of Dr. Staples' very satisfied patients. So now let's talk about, other than full dentures, what other procedures are available?
I think I mentioned earlier that there are applications for replacing one tooth, maybe 2 or 3 missing teeth. People who have partial dentures that are ill-fitting, we can also stabilize those. We can actually replace all the teeth in the mouth. Say when someone has a denture, we can replace all their teeth with fixed dental work if that's what they want. But it's a myriad of things that we can do. I actually have some examples that I brought. You know, we've mentioned the full dentures. I don't think I have shown that, but we usually, in an upper denture, we usually place 6 implants, and then we retrofit the denture with these O-ring attachments, and then that makes this denture snap in place. Another thing that's really good about the upper is that, I don't know if you noticed, but we're allowed to cut out all that palatal tissue that covers their palate, and it affects their taste. We had a lot of people tell us that once we do this, everything tastes better now. And we don't have to extend it back as far, and it doesn't gag them, and they really enjoy that, not having to have that denture suck into place or have that goop. Lower denture is the same. We use 4 to stabilize a lower denture. This is an example of a person who just has a front tooth missing. And like I said, we place this implant. We can place it in the morning and make the crown. I actually have a procedure that I can do where I use a little surgical stent, and I can place the implant and have the crown pre-made and cement the crown. Sometimes it takes as little as 30 minutes to replace a tooth. We can do that. We also offer replacing multiple teeth. We usually use 1 implant. If a tooth has 1 root, when we replace it, we put 1 implant. If it has more than 1 root, like a molar, then we usually use 2. So in this particular example, we use 4 implants to replace these 3 teeth. And they actually glue in place. This snaps in place, because if I turned it over, it would fall off, and you and I'd be chasing it all over the stage. But so we can replace more than 2 or 3 missing teeth or 1 tooth. And there's a new procedure that we've come out with that's really exciting for me. It's called a hybrid. I've had people come in and say, Dr. Staples, I'd like to get my denture replaced. I'd like to have some natural teeth back again. I'm tired of all this pink acrylic. And we call this our fixed on 6. And we'll place 6 implants in the upper or the lower. And this is actually a material that's made out of zirconium. It's a NASA product, spin off of NASA. But we actually bake porcelain on the front of this, and that looks just like a bridge. I mean, there's no pink acrylic. In this particular procedure, we actually use a type of an O-ring attachment, and I snap this into place, and it's not to be taken off by the patient. Actually, they come into my office every 6 months to have their teeth examined and checked, and we take this off with a hygienist, and it's very difficult to get off. It's not something they do every day like they do with their denture, but we literally, well, I won't do it again, but we clean
secure.
it. Yeah, it's very secure. And what's really good about this is that there's no pink acrylic. It looks like these teeth are just coming right out of the gum. And I mean, I've had this model sitting on the table when I was talking to someone about a denture, and they asked me, what is that? And this is what a lot of people are wanting now. And it's in between this and actually placing 12 implants and 12 crowns. This is kind of something in between a denture and that, and it's a lot of people are just loving it.
It looks like they match the other teeth too.
Mm-hmm, yeah.
I notice on the one, I think you've mentioned this before, where it can be matched.
Yeah, we have great labs. My son works with me. He does all my individual crowns, and Blake, and he's a master at it. He has mastered this other technology we have that's called CEREC, which allows me to make a crown in my office the same day. And Blake does all those. He does a great job. He actually does some work for some other dentists, and he has calls coming in constantly from dentists all over the country asking him how to fabricate these crowns using the CEREC machine on top of these implants. And so it's a great procedure.
Tell me about maintenance that someone would have after they've had the mini dental implant procedure.
Let's talk about the denture first. When we place the mini dental implants and we've adjusted the bite and they're good, we ask them to come back every 6 months. We love to check those O-rings. That's really the part. They take their denture out every day to brush the implants and to clean their denture, and then they put it back in. We ask that they sleep in these actually. And patients are really happy about that. They don't take them out at night and put them in a jar. They actually wear them. But with these sitting in their mouth like that, it has a tendency for the bone and the gum tissue to stay adapted to the denture. We don't see as much bone loss or regression of the soft tissue under the denture. So, but we like to see them every 6 months to check those O-rings and to check the fit and their bite in their denture. With a single crown, it's treated just like any of your other teeth. You brush it and floss it. Use a water pick. I encourage water picks. I'm a big fan of water picks now. And but you brush and floss that tooth. If it's a bridge, we actually show people how to clean in under those bridges. Like I said, the water pick's great. Great fan of water picks. And if it's the bridge like I showed you, that a hybrid, we still ask them to come in every 6 months. We stand behind our work too. If our patients come back to us regularly, then if they have a problem with anything, with their implants or with the denture or crown, then we take care of it. I have a lot of doctors that are referring me patients now, and after I do the procedure for them, I just encourage the patient to continue seeing their doctor on a regular basis and let him do maintenance. I'd love to see them. I always like to see my implant patients, but they're welcome to go back to their doctor, obviously, and let them do their every 6 month recall type work. But there's really not any more maintenance than you would with just a natural dentition.
And you mentioned something there that catches my ear. I remember that we've talked in the past about, first of all, the magic gum. I love how it will form around, and I'll let you elaborate a bit on that. But also address how when someone loses a tooth, how vital it is to do something about that quickly so that you don't have, you've taught me that you'll lose, it'll start to go away. But you explain that.
That's a great question. As I mentioned earlier, there are more than 40 million people walking around with at least one missing tooth, really more than that. And when you lose a tooth, that bone that was around that root resorbs away. It can directly affect the teeth on either side of that missing tooth. If you have 2 or 3 missing teeth, then we've got teeth moving all over the place. We have the tooth opposite dropping down or raising up, and teeth leaning and tilting. And if we can catch it after just one missing tooth, if we can catch it then, we stop this snowball effect of problems that arise. One of the things that in all the magazines, that in every waiting room that you sit in and read articles, is TMJ. We've all heard of TMJ. Well, that's one of the effects of missing teeth. It can lead to problems with your temporal mandibular joints and bite problems, headaches and neck pain. It's really important that if we can stop this progression of losing more and more teeth, it's so much easier for the patient to restore it then. It's going to save money in the long run.
Let's talk about cost, how cost effective mini dental implants are versus traditional.
I usually tell patients that mini dental implants are 5 times less. The procedure is less invasive. There's less pain involved. There's less healing time involved. It takes less time to complete the procedural reconstruction or the restoration. And because of all of that, they cost less. It's the mini dental implant is a one-piece implant, whereas the traditional implants are two-piece implants. It takes multiple surgeries to place a two-piece implant and get to the point where you can restore it. Where with the mini implant, it can be done like I told you, in one appointment. So from a economics factor, there's less doctor's time involved with the mini implant. There's less chair time. There's less time involved with the lab to restore that work. So with saving our chair time and my time, it costs less. And being in the fact that it's a one-piece implant as opposed to a two-piece implant, also it's more cost effective. So overall, it's just a more affordable solution than a traditional.
Sounds like that this is a great option for so many people. Why don't you tell us how we can find out more about the mini dental implants?
A phone call is great. Donna's there. Just call and ask her a question. Our telephone number is 668-6700. We can also reach us by 1-866-GET-MINIS. I have a website, randystaplesdds.com. A lot of great information on that website. We update it daily. There's a lot of good information on our website. We have brochures available to patients, so we're glad to mail out or they come by and pick up. And I encourage people to do research. Look on the internet. There are a lot of things that we might want to see on the internet, but there's so many great things on the internet and a lot of information. And so I encourage people to do the research. I may be the first appointment, the first time they've talked to anyone about implants. I may be a second or third, whatever. I always encourage people to do some studying themselves. Give us a call. We're in free consult, so we'd be happy to talk to anyone at any time.
Thank you, Dr. Staples, for joining us today. This has been such valuable information for everyone.
My pleasure.
And remember, you can learn more by calling Dr. Staples' office at 668-6700. You can also go online and do that research at randystaplesdds.com. Thank you again for joining us, and remember, you can smile again.